You are about to watch a woman work in the space between a heartbeat and a flatline, and the man who spent 3 years calling her incompetent is going to stand there with blood on his gloves and nothing left to say. Stay with this until the very end. Drop your city in the comments right now. Let's see how far this story travels. And if this hits you the way it hit everyone who was in that hallway that night, hit the like button before you even finish watching. Now let's go back to where it started, because nothing about what happened in that trauma bay makes sense unless you understand exactly who they thought she was and exactly who she actually was. The fluorescent lights in the Mercy General Emergency Department had a flicker in them that nobody ever fixed. Not the maintenance crew, not the facilities manager, not the hospital administrator who walked those halls twice a year in a pressed blazer and called himself a leader. The lights buzzed and stuttered over the intake desk like a dying pulse, and most of the staff had long since stopped noticing. Elena Voss noticed. She noticed everything. That was the problem, depending on who you asked. She had been working Mercy General's trauma intake for 3 years, 2 months, and 11 days. She knew this not because she was sentimental about it, but because she tracked things: duration, pattern, deviation. She was 34 years old, 5 feet 4 inches tall, and built like someone who had once carried weight for a living. Not gym weight, not performance weight, but the kind of dense functional strength that develops in people who have spent years moving fast in difficult terrain. She kept her dark hair pulled back, so tight it looked painted on. She wore her scrubs like a uniform, which, for her, they were. She did not smile at people she did not trust. In a hospital full of people performing warmth for patients and performing confidence for supervisors, Elena's refusal to perform anything at all made her either invisible or suspicious, depending on who was looking. Dr. Marcus Hale was looking. He was always looking in the way that powerful men look at the things they have decided are beneath them, with a kind of aggressive disinterest, the way you glance at a chair before you sit on it. Hale was the chief of trauma surgery at Mercy General. He was 51, broad-shouldered, and carried his reputation in front of him like a plow. His hands had been written about in a medical journal. His residents called him the Blade, and they meant it as reverence. He had a way of filling a room, not with noise, but with gravity, the sense that the important thing in any given space was wherever he happened to be standing. He had decided about Elena Voss in the first week she arrived. He had watched her move through intake, methodical, unhurried, almost bovine in her steadiness, and he had formed a conclusion the way men like him form conclusions, quickly, confidently, and without revision. She was slow, not incompetent exactly, but the kind of careful that becomes a liability when seconds matter. She double-checked things other people trusted to instinct. She paused before she moved. She asked questions that, in Hale's estimation, a competent professional should already know the answers to. He had said it to his chief resident, Dr. Priya Shun, in the scrub room one Tuesday morning, not quietly enough. The intake nurse, Voss, she's going to get someone killed with that hesitation of hers. Mark my words. Priya had said nothing. She had learned when to say nothing. Elena had been in the hallway outside the scrub room. She had heard every word. She had stood there for exactly 4 seconds. She counted. And then she had walked back to her station and checked the chart in front of her and done her job. She did not confront him. She did not file a complaint. She did not perform injury. She stored it, the way she stored everything, in a place that had no name but served a function. In another life, the life she did not discuss, the life that existed in a sealed personnel file and a handful of classified after-action reports, she had learned that the most dangerous thing you could do was let someone know they had gotten to you. Let them think they were right. Let them get comfortable. Comfortable people stop watching. Nobody at Mercy General knew what Elena Voss had done before nursing school. Not really. Her application listed prior military service. The HR file noted an honorable discharge. There is a gap of 4 years between her discharge and her enrollment in the accelerated nursing program at St. Catherine's, a gap that nobody had ever asked her to explain and that she had never volunteered to fill. The woman who had written her recommendation letter for nursing school was a colonel in the Army Medical Corps who had since retired to a farm in Vermont and who had described Elena in the letter as the most capable person I have ever watched function under pressure. in any capacity, military or civilian. The hiring committee at Mercy General had read that sentence and moved on. People write generous things in recommendation letters. It was a known fact. What was not in Elena's file, what existed only in the memory of people who had been there and in documents that required a security clearance to access, was this: Elena Voss had spent 6 years as a Special Operations Combat Medic attached to a unit that officially did not run the missions it ran. She had performed emergency surgical interventions in conditions that would have been considered impossible by any standard. In vehicles, in rubble, in the dark, in the rain, with equipment that was sometimes nothing more than what she could improvise from what was around her. She had kept 11 people alive who should have died. She had lost 3 who she still saw, sometimes in the flicker of fluorescent lights. She had been awarded a decoration she was not permitted to name in mixed company, and had been offered a commission twice, and had declined both times because something in her had already begun to understand that she was done with that particular version of herself. She had come to Mercy General because she wanted to do the work without the weight of the other thing. She had come to be ordinary. She had not entirely succeeded. The night everything changed was a Thursday in November. The rain had been coming down since 4 in the afternoon, the kind of cold vertical rain that turns parking lots into mirrors and makes headlights look like they're bleeding. The ER was running at 112% capacity, which was not unusual. What was unusual was the call that came in at 9:47 p.m. A man named Garrett Cole had been pulled from a construction site collapse 4 miles east of the hospital. He was 58 years old, 220 pounds, and by the time the paramedics had him in the rig, he had a tension pneumothorax developing in his right chest, a suspected splenic laceration, and a blood pressure that was dropping like something had cut the cord holding it up. The lead paramedic, a compact woman named Danny Reyes, who had been running calls for 11 years, was on the radio with Mercy General's intake desk at 9:49. Her voice was level, but there was something underneath it, a vibration that people who have done this work long enough learn to read. Elena was at the desk. She took the call. Danny said, "Inbound, ETA 6 minutes. Male, 58, construction collapse. Suspected tension pneumo right side. BP 60 over palp, GCS dropping. He's got something going on in the belly too. We've got 2 large bore IVs, 1 liter LR in. He's not responding the way I want." Elena said, "Is he moving air on the right?" A pause. "Barely. Maybe not at all. What's his trachea doing?" Another pause, shorter, deviating left. "He needs a needle before you get here. Do you have a 14 gauge? "Yes. Second intercostal space, midclavicular line." "You know this." "I know it. I wanted confirmation." "You have it. Go." She hung up and turned to the board and began moving pieces. She called the trauma bay. She called Priya Shun, who was the senior resident on that night. She called for O-negative blood from the bank. She pulled a chest tube tray and a thoracotomy kit and set them both on the supply cart outside Trauma Bay 2, not because she had been told to, but because she had done the math in her head and understood what was coming. She did all of this in under 4 minutes, moving with the particular economy of someone who has learned that wasted motion is a form of violence. Dr. Hale was not supposed to be there that night. He had been in the hospital for a departmental meeting that had run long, and he was in the corridor outside the surgical suite when he heard the overhead page. He stopped. He listened. He made a decision and turned around. He arrived in the trauma bay at 9:54, 2 minutes before the ambulance, still in his street clothes with a white coat thrown over them. He looked at the setup Elena had arranged and said nothing, which was not the same as approval. He looked at Priya, who was gloving up, and said, "What do we have?" Priya told him. Hale nodded and began to wash. The ambulance bay doors opened at 9:56. Garrett Cole came through them on a stretcher, gray-faced and wet from the rain, his chest moving in a way that was wrong. Too shallow on the right, too compensatory on the left, the body trying to solve a problem it did not have the tools to solve. Danny Reyes was at his head, her hand on his jaw, her eyes already scanning the room for the person in charge. Her eyes found Elena. Elena was already moving. She had her hands on the stretcher rail before it stopped rolling, and she was reading him color, breath pattern, neck veins, the way his fingers were curled. in the time it takes most people to say hello. She said to Danny, "The needle decompression held? For now." Pressure came up to 72. "It's slipping again. You need the chest tube. Right side now." Hale was at the sink, still scrubbing. He heard this and said, without turning around, "I'll make that determination when I've assessed the patient." Elena did not look at him. She said, "His trachea is deviating. His breath sounds on the right are absent. His pressure is 72 and falling. The determination has been made." There was a silence in the room that had a specific texture. Priya felt it. The two nurses on the team felt it. Danny Reyes, who had not been in this room before, felt it and understood immediately that she was watching something that had a history. Hale turned from the sink. His face was doing something controlled and precise. He said, "Nurse Voss, chest tube tray is open," Elena said. "Lidocaine is drawn. Betadine is on the field. You can do it in 90 seconds if you start now." Hale crossed the room in 4 steps. He looked at the tray. He looked at the patient. He looked at Elena, and the look contained everything. The 3 years of dismissal, the scrub room comment, the accumulated weight of a man who had decided who someone was and did not enjoy being made to revise. He picked up the scalpel. He made the incision. He inserted the finger. He reached for the tube. And then something happened that nobody in that room had ever seen Marcus Hale do. He stopped. His hand, the hand that had been written about in a journal, the hand his residents called a gift, it was trembling. Not much. Not visibly to anyone who was not paying attention. But Elena was always paying attention. It was a tremor, fine and fast, and it lasted about 2 seconds, and in those 2 seconds Garrett Cole's blood pressure alarm began to sound, and his oxygen saturation began to drop, and the room began to tip toward the kind of chaos that ends with a family in a waiting room getting the news that changes everything. Hale's hand steadied, but the tube was not in. He had hesitated, not from incompetence, she would understand later, but from a spasm, a neurological flicker that he had been managing privately for 4 months, and that had, until this moment, never surfaced in front of anyone. The tube was at the lip of the incision and going nowhere, and the monitor was screaming, and Priya said, "BP's dropping, 58 systolic," and Hale said nothing, which was the loudest thing Elena had ever heard him say. She stepped forward. She did not ask permission. She did not announce herself. She simply moved into the space he was occupying, and her hands replaced his hands, and she said, quietly, directly into the operative field, not to him but to the task, "I've got it." What happened next took 90 seconds. Not 90 seconds as a figure of speech. 90 seconds on the clock on the wall, which Priya Shun would later confirm because she was watching it, because she could not look away. Elena guided the chest tube through the incision with the kind of tactile precision that is not taught in nursing school, that is not taught anywhere that has a curriculum, that is learned in places where the alternative to precision is a body bag. She met the resistance of the pleural space and navigated it without hesitation, without the exploratory tentative quality of someone who is doing a thing they have only read about. She was doing something she had done before, many times, in conditions that made this trauma bay look like a spa. She felt the tube seat. She heard the rush of air. She watched the water-sealed chamber begin to bubble, and she said, "Secure it," to the nurse on her left without looking up, and the nurse secured it. Garrett Cole's oxygen saturation, which had been at 71%, began to climb. 76, 81, 87. The blood pressure alarm changed its tone as the number rose. 64, 70, 78. The room, which had been holding its breath, exhaled. Elena stepped back. She stripped her gloves. She looked at the monitor for exactly 3 seconds. Then she looked at Hale. He was standing at the edge of the field. His hands were at his sides. His face had done something she had not seen it do before. It had gone very still, in a way that faces go still when the person inside them is recalibrating something fundamental. He was looking at her the way you look at a thing you thought you understood and have just discovered you did not understand at all. He said nothing. She said nothing. Priya said, "We need to get him a CT for the belly. He's still losing something." And Elena turned back to the patient, because that was the job, and the job was not finished. The CT confirmed what Elena had suspected from the moment she read the paramedic's report. grade 3 splenic laceration, active extravasation, the spleen bleeding into the abdomen in a slow, determined way that would become unsurvivable if it was not addressed. Garrett Cole went to the OR at 10:22 p.m. Hale scrubbed in. The procedure took 2 hours and 14 minutes. The spleen was repaired, not removed, a choice that reflected Hale's skill, which was real, whatever else was true about him. Garrett Cole went to the ICU at 12:41 a.m. and was breathing on his own by morning. At 1:15 a.m., in the corridor outside the surgical suite, Marcus Hale found Elena Voss writing a patient note at the rolling workstation she used when the desk was busy. The corridor was quiet. The rain had stopped. The fluorescent lights buzzed their familiar broken rhythm. He stood beside her. She did not look up. He said, "Where did you learn to do that?" It was not a question. It was the kind of statement that is reaching towards something it does not have words for yet. She said, "Learn to do what?" "You know what?" She finished the sentence she was writing. She saved the note. She looked at him, then, directly, with the particular quality of attention she gave to things she was deciding about. She said, "Military." He waited for more. She did not give him more. He said, "That was a surgical procedure. That was not nursing school. The patient needed the tube. You were unavailable." The word landed. Unavailable. Not frozen. Not trembling. Not compromised. Unavailable. She had given him the only version of events that preserved what he needed preserved, and she had done it without being asked, and he understood this, and the understanding moved across his face like weather. He said, "I have essential tremor. It started 4 months ago. I've been managing it." She said, "I know." He looked at her. "You know, I've watched your hands for 3 years. I noticed the change in September." A pause. "You should talk to neurology." He was quiet for a long moment. The lights buzzed. Somewhere down the corridor, a monitor beeped its steady reassurance. He said, "I told Priya Shun 2 years ago that you were going to get someone killed with your hesitation. I know that too. You were in the hallway." "Yes." Another silence. This one had a different texture, heavier, with more underneath it. He said, "I was wrong." She looked at him for 3 more seconds. Then she turned back to the workstation and opened the next chart. She said, "Garrett Cole's family is in the waiting room. Someone should update them." He went. She stayed. The lights buzzed. She did not smile because she was not performing anything. But something in her, in the place that had no name, registered the moment and held it. Not as triumph, not as vindication exactly, but as something quieter and more durable. As proof. As the record being corrected, finally by reality. The story did not end there. Stories like this never end where you think they end. 3 days after Garrett Cole's admission, a man named Ray Decker walked into Mercy General's emergency department at 2:30 in the afternoon looking for his brother. Ray Decker was 43 years old, wore a gray jacket over a flannel shirt, and had the particular stillness of someone who has learned to be still in order not to be noticed. Elena was at the intake desk. She looked up when he approached. She noted the jacket, too warm for the temperature inside, worn despite the heat of the waiting room. She noted the stillness. She noted the way his eyes moved through the room before they settled on her, cataloging exits and personnel with a practiced efficiency that most people would not recognize and that she recognized immediately. She said, "Can I help you?" He said, "My brother was brought in 3 days ago." "Garrett Cole." She said, "I'll need to check his current location. Can I get your ID?" He reached into his jacket. She watched his hand. He produced a wallet, opened it, showed her a driver's license. "Ray Decker," the license said. She looked at it. She looked at him. She said, "One moment." She turned to her screen. She pulled up Garrett Cole's record. ICU, room 4, stable, family contact on file. A sister named Mara Cole, no brothers listed. She kept her face neutral. She kept her voice neutral. She said, "He's in the ICU. Visiting hours are 2 to 4 and 6 to 8. You'll need to check in at the ICU desk." He said, "Is he going to make it?" She said, "I can't share clinical details. The attending can speak with you." He said, "Right," and he left. She watched him go. She watched him cross the waiting room and push through the main doors, and she watched him through the glass as he stood on the sidewalk and made a phone call. She watched the way he held the phone, close, angled, the speaker near his mouth rather than his ear, the posture of someone who does not want to be overheard and has done this before. She watched him for 45 seconds. Then she picked up her desk phone and called the ICU charge nurse. She said, "A man just left the ER claiming to be Garrett Cole's brother. He's not on the family contact list. Do not allow him access until you've verified with the patient or the listed contact." The charge nurse said, "Got it. You think he's a problem?" Elena said, "I think he's worth verifying." She paused. Lock Cole's room. She did not explain why. She did not have an explanation that she could put into clinical language. What she had was pattern recognition, the deep groove kind that does not come from textbooks, that comes from years of learning to read the difference between a person who is worried about someone they love and a person who is worried about something else entirely. Ray Decker had not looked like a worried brother. He had looked like a man on an assignment. She was right. What Elena did not know yet, what she would piece together over the next 6 hours from fragments and from a conversation she was not supposed to overhear, was that Garrett Cole was not simply a construction worker who had been caught in a site collapse. He was a site foreman who had, 3 weeks before the accident, filed a confidential complaint with the state labor board alleging that the construction company he worked for, a firm called Crest Development, which had contracts with the city worth $47 million, had been systematically falsifying safety inspections and cutting structural corners in ways that had already injured 2 workers and would, he believed, eventually kill someone. The collapse that had put him in a hospital had not been an accident. The site had been deliberately destabilized. Someone had removed a temporary support structure that should not have been removed. The labor board investigator assigned to Cole's complaint, a woman named Nadia Osei, had been trying to reach him for 3 days and had been told, each time she called the hospital, that he was unavailable. Nadia Osei arrived at Mercy General at 4:15 p.m. that same Thursday. She was 37, wore a dark blazer over dark slacks, and carried a leather folio that she held with both hands like it contained something she was not willing to lose. She came to the intake desk, and she asked for Elena Voss by name. Elena looked up, surprised in the specific way she allowed herself to be surprised, a single raised eyebrow, quickly lowered. She said, "That's me." Nadia said, "My name is Nadia Osei. I'm with the State Labor Board. I'm the investigator on Garrett Cole's complaint." She lowered her voice. "I think someone tried to kill him, and I think whoever did it knows he's here and knows he's going to recover." Elena looked at her for a moment. Then she said, "Come with me." She took Nadia to the small family consultation room off the main corridor, a room with a door that locked, which Elena locked, and she listened to what Nadia had to say. Nadia laid it out in the precise, evidence-organized way of someone who has been building a case and is now watching the case become something more urgent than paperwork. Crest Development, the falsified inspections, the 2 prior injuries, both workers who had subsequently recanted their statements under circumstances Nadia described as pressure that I can document, but not yet prosecute. The site collapse, the removed support structure, and Ray Decker, whose name appeared in Nadia's file as a former security contractor employed by Crest Development's parent company. Elena said, "He was here 2 hours ago." Nadia went very still. "Here, in this hospital, claiming to be Cole's brother. He's not listed as family. He's not family. He's—" Nadia stopped. She opened her folio and found a page and turned it toward Elena. A photograph, printed from a database. Ray Decker, the same gray jacket, the same stillness. He works for a man named Victor Marsh. Marsh is the CFO of Crest's parent company. He's also the person who stands to lose the most if Cole's testimony reaches the labor board. Elena looked at the photograph. She looked at Nadia. She said, "What do you need?" Nadia said, "I need Cole to give a recorded statement before someone gets to him. I have a device. I have authorization. I just need access, and I need it to be safe." Elena said, "I can get you access. The safe part is more complicated." She thought for a moment. "There's a man who tried to come in through the front. He'll try again, or he'll send someone else. We need eyes on the ICU entrance." Nadia said, "I can call the police." Elena said, "You can. That takes time, and it creates noise. Noise tells Marsh's people to move faster." She paused. Give me an hour. What Elena did in that hour was the kind of thing that does not appear in a nursing job description. She spoke to the ICU charge nurse, a veteran named Theo Park, who had been at Mercy General for 19 years and who had a quality of unflappable practicality that Elena respected deeply. She told Theo what she knew and what she suspected and what she needed. Theo listened without interrupting, which was one of his best qualities, and then he said, "You want me to run a quiet lockdown on 4 without alerting the front desk." She said, "I want you to run it without alerting anyone who doesn't need to know." He said, "That's the same thing." He paused. Done. She spoke to the hospital's security supervisor, a former county sheriff's deputy named Lou Briggs, who she had cultivated a working relationship with over 3 years of noticing things and reporting them accurately and never wasting his time. She described Ray Decker. She gave Lou the physical description, the gray jacket, the height, the stillness. She said, "If he comes back, I need to know before he gets past the lobby." Lou said, "You think he's dangerous?" She said, "I think he's a professional." Lou said, "That's a yes." He got on his radio. She went back to the desk. She worked her shift. She watched the doors. At 6:40 p.m., Ray Decker came back. He was wearing a different jacket, dark blue this time, and he had changed his hair somehow, or maybe it was the light. But the stillness was the same, the eyes moving through the room before they settled. Elena saw him from the desk and felt the thing she had learned to feel without acting on, a cold clarity, a narrowing of attention to the single point that mattered. She picked up her phone and texted Lou, "Lobby now, blue jacket." Lou had him stopped at the security desk before he reached the elevator bank. There was a conversation that Elena could not hear, but could read from across the lobby. Ray Decker presenting identification, Lou being polite and immovable, the particular negotiation of a man who is used to getting through things encountering a wall he did not expect. Decker left. He did not make a scene. Men like him never make scenes in lobbies. They find other doors. Elena called Nadia. She said, "You have maybe 40 minutes before he finds another way in. How long do you need with Cole?" Nadia said, 20 minutes if he's cooperative." "He'll be cooperative. He filed a complaint. He wants to talk." She paused. "Go now. Theo will meet you at the ICU entrance." Nadia got the statement. It took 18 minutes. Garrett Cole, pale and diminished against the white of the hospital bed, but entirely present, his voice steady with the particular steadiness of a man who has decided that what he knows is worth the cost of saying it, told Nadia everything. The falsified reports, the names, the dates, the specific morning 3 weeks ago when he had seen a Crest supervisor remove the temporary shoring from Bay 7 and had known, with the bone-deep certainty of a man who had been building things for 30 years, that something was going to come down. The recording was encrypted and transmitted to the Labor Board secure server at 7:03 p.m. At 7:11 p.m., Nadia called the police. At 7:45 p.m., 2 detectives arrived at Mercy General and took a statement from Lou Briggs regarding Ray Decker's 2 visits. At 8:20 p.m., Ray Decker was located in the hospital's parking structure. He had found another door, as Elena had predicted, and was detained for questioning. Victor Marsh, the CFO of Crest Development's parent company, was served with a preservation order at his office the following morning. The investigation that followed would take 7 months and result in the indictment of 4 individuals, the suspension of 11 construction permits, and the largest labor safety fine in the state's history. The 2 workers who had recanted their statements came forward again, this time with lawyers. The story ran in the newspaper under a headline about corporate negligence and institutional corruption and the quiet bravery of a foreman who had decided that what he knew mattered more than what it cost him. Garrett Cole's name was in the story. Elena Voss's name was not. She had not spoken to the reporter. She had not been asked to, and she would not have agreed if she had been. This was not modesty. This was preference. She had spent years learning the value of not being seen, and she had not unlearned it just because the setting had changed. Dr. Marcus Hale was seen. He was seen in a different way, in a different room, with different stakes. 6 days after Garrett Cole's surgery, Hale walked into the office of the hospital's chief medical officer and disclosed his essential tremor diagnosis. He brought the neurology consult he had been quietly pursuing for 4 months. He brought the documentation of his self-monitoring and the accommodations he had been making, some appropriate and some not. He did not do this because he was forced to. He did it because something had shifted in him in the trauma bay, in the 90 seconds when his hands had failed him and someone else's hands had not, and the shift had a direction, toward honesty, toward the reckoning that he had been postponing. The CMO, a careful woman named Dr. Sylvia Tran, received this disclosure with the gravity it deserved. There were consequences: a temporary suspension from independent surgical practice, a structured return-to-work plan, mandatory neurology follow-up, and a review of cases from the prior 4 months. The review found no adverse outcomes attributable to the tremor, which was a relief to everyone and a testament to the compensatory measures Hale had been taking, however imperfect. He was cleared to return to supervised practice 8 weeks later. He was not cleared to return to independent practice for 4 months after that. And when he did return, it was with a treatment regimen that controlled the tremor to within acceptable parameters and with a monitoring protocol that he had, by then, stopped resenting. He was humbled, not broken. Humbled, which is different, which requires the person inside to still be there and to be paying attention. He was a better surgeon for it, eventually. Not immediately, but eventually. Priya Shun, who had been in the trauma bay that night and had watched the 90 seconds with the clock on the wall, came to Elena 3 days after the Cole surgery. She found her at the rolling workstation in the corridor, same place Hale had found her. She stood beside her in a way that was asking permission for a conversation, and Elena looked up and gave it. Priya said, "I've been trying to figure out what to say to you." Elena said, "You don't have to say anything." "I know. I want to." A pause. "I heard what he said about you. In the scrub room. 2 years ago. I know you heard it." Priya looked at her. "You knew I was there. You were always there. You're his resident. You follow him everywhere." Not unkindly. As a fact, it wasn't your responsibility to say something. "I should have." Elena looked at her for a moment. She said, "Yes, you should have. Not cruel, not forgiving, accurate, but you were protecting your career. That's a real thing." Priya was quiet. Then she said, "Where did you learn to place a chest tube like that?" Elena said, "A long time ago. Somewhere else." Priya waited. Elena did not continue. Priya said, "The military." "Yes." "What kind of military?" Elena looked at her. The look was not unfriendly. It was the look of someone deciding how much of a door to open. She said, "The kind where you learn things you don't get to talk about." Priya nodded slowly. She said, "For what it's worth, what you did that night was extraordinary. I've been in trauma for 6 years. I've seen attendings place chest tubes. I've placed them myself. What you did was different. The speed, the feel of it, it wasn't textbook. It was," she searched for the word, "it was memory." Elena said, "Everything is memory, eventually." Priya almost smiled. She said, "I'm going to be an attending next year. I want to be the kind of attending who—" She stopped. Started again. "I don't want to be the kind who decides about people before I know them." Elena looked at her for a long moment. She said, "Then don't." It was not a blessing. It was not a war moment between two women who are now friends. It was a statement of the possible, offered plainly, which was the most Elena Voss gave to most people and which was, for those who understood her, more than enough. The night of the Cole surgery had one more chapter, one that Elena did not learn about until weeks later from Danny Reyes, the paramedic who had brought him in. Danny came back to Mercy General on a different call a week after the Cole night, and she found Elena at the desk, and she said, "I wanted to tell you something." Elena said, "Okay." Danny said, "When I was on the radio with you, before we came in, you told me to needle him. I confirmed what you already knew. You confirmed it in about 4 seconds. I've called in 100 critical patients. Most intake nurses, they're writing things down, they're alerting the team, they're doing the checklist. You were diagnosing. On the phone, without seeing him." Elena said, "You gave me good information." "I give everyone good information," Danny said. "Not everyone does what you did with it." She paused. "He's alive because of that call. Because of those 4 seconds." Elena said, "He's alive because you needled him in the rig and because Dr. Hale repaired his spleen." Danny looked at her. "You're not going to take any of it, are you?" Elena said, "I'm going to take the part that's mine. The rest belongs to the people who did it." Danny shook her head slowly, not in disagreement, but in the particular way people shake their heads when they encounter something they do not have a category for. She said, "What's your part?" Elena thought about this for a moment. She said, "I made sure the right things were in the right place at the right time." Danny said, "That's everything." Elena said, "Sometimes it is." The weeks after the cold case had a different quality at Mercy General. Not dramatic. Nothing so overt as a shift in culture or a formal acknowledgement. More like the way a room changes when a window is opened. The same room, the same furniture, but the air is different, and everyone breathes a little differently without quite being able to say why. The nurses on Elena's unit had always respected her competence in the way that competent people respect each other, practically, without ceremony. Now there was something added, a quality of attention that was not quite deference and not quite awe, but lived somewhere between the two. People asked her things they had not asked her before. Not clinical things, they had always asked her clinical things, but judgment things. Situational things. She's probably noticed something things. She answered when she could and deflected when she couldn't, and kept her hair pulled back and her face neutral and her attention on the work, which was always the work, which was always someone in a bad moment needing the right thing done. Lou Briggs, the security supervisor, stopped by the desk one morning with 2 coffees and set one beside her without comment. She looked at it. She looked at him. He said, "You called it right on, Decker." She said, "You stopped him." He said, "You told me where to look." They drank their coffees. This was for both of them a complete conversation. Nadia Osei sent a letter to the hospital's nursing director 3 weeks after the cold case, commending Elena Voss by name for her role in facilitating the protective measures that had allowed Garrett Cole's testimony to be safely recorded. The nursing director, a woman named Carol Huang, who had been at Mercy General for 22 years and who had a reputation for reading people accurately, read the letter twice and then called Elena into her office. She set the letter on the desk between them and said, "This is remarkable." Elena said, "I did my job." Carol said, "Your job is intake assessment and patient care coordination." Elena said, "A patient was at risk. I coordinated his care." Carol looked at her for a long moment with the expression of someone who is choosing their next words carefully. She said, "Elena, I have your file. I have your application, your references, your performance reviews. I have 3 years of watching you work. And I have this letter which describes you doing things that are," she paused, "that are not in any job description I've ever written." Elena said nothing. Carol said, "I'm not asking you to explain yourself. I'm asking you, is there anything you need? Anything this hospital can do to better use what you bring here?" Elena looked at her. The question was genuine, which was not always true of questions from administrators. She thought about it for a moment, really thought about it, which she could tell Carol appreciated. She said, "There's a gap in how we handle threat assessment for at-risk patients. Patients who come in under circumstances that suggest they might be targets. Domestic violence, labor disputes, organized crime. We treat them clinically, but we don't have a protocol for the security dimension." Carol said, "You want to write one?" Elena said, "I want to help write one. With Lou, and with input from the police liaison." Carol said, "Done." She paused. "What else?" Elena said, "That's enough for now." She meant it. She was not being modest. She was being precise about what she needed, which was the work, which was always the work, and the ability to do it well, and the tools to do it better. She did not need a title. She did not need a plaque. She did not need Marcus Hale to say the right words in the right order, though he had, eventually, said them. She needed the window to stay open and the air to keep moving and the next patient to get what they needed when they needed it. Garrett Cole was discharged from Mercy General on a Tuesday morning, 22 days after the collapse. He walked out under his own power, which his surgical team had not been certain he would do. He was thinner, and he moved carefully, with the particular deliberateness of a body that has been reminded of its limits and is negotiating a new relationship with them. His sister Mara was with him, a compact woman with his same jaw and his same steady eyes. At the discharge desk, he stopped and asked for Elena Voss. She came out from behind the desk. He looked at her. He said, I was told you're the one who set up the chest tube. She said, Dr. Hale performed the procedure. He said, I was also told that's not the whole story. She looked at him. She said, you're going to be fine. Take the follow-up appointment seriously and don't lift anything over 10 pounds for 8 weeks. He said, I want to thank you. She said, thank the paramedic who needled you in the rig. Thank Dr. Hale for the spleen repair. Thank Nadia Osei for doing her job. He said, I'm thanking you too. She held his gaze for a moment. She said, you filed the complaint. You knew what it might cost you, and you filed it anyway. That's why you're alive, because you were worth saving. She paused. Take care of yourself, Mr. Cole. She went back to the desk. He watched her go. His sister took his arm, and they walked toward the exit in the November light that was coming through the glass doors, pale and clean after the rain. He did not look back, but he remembered her. He would remember her for a long time. Not as a hero, not as an action figure, but as a woman at a desk who had seen him clearly when it mattered and had put the right things in the right place and had done it all without making it about herself, and who had, in doing so, given him back the rest of his life. Elena Voss watched them go. She watched the doors close behind them. She turned back to the board, which had 4 new patients on it, each one a story she did not know yet, each one a problem she had not yet solved. The fluorescent lights buzzed their familiar broken rhythm above her. She had put in a maintenance request about those lights twice. She would put in a third. Eventually someone would fix them, or they would not, and either way the work would continue, and she would be here, steady and precise and unhurried and entirely, devastatingly capable in the way that only people who have carried real weight in real darkness ever learn to be. She opened the first chart. She began to read. If you made it to the end of this story, you already know why it matters, because the most dangerous assumption you can make about a person is that you have already figured them out. Drop your city in the comments. Hit the like button if this one stayed with you. Subscribe because there are more stories like this one. Stories about people who do the work without asking for the credit, who carry more than you can see, who show up when it counts in ways you will never fully understand unless you were in the room. We'll see you in the next one.